Did you know that you don't need hydrogen peroxide to clean wounds? I'm Dr. Mona, a board-certified pediatrician and mom, and we're discussing how to care for a wound that doesn't need stitches or dermabond at home, when a wound needs closure and options for closure, how to reduce scarring, and the most common mistakes I see when it comes to wound care. Let's get to it. So there are many kinds of wounds. The most common wounds we see in kids are abrasions or scrapes and lacerations or deep cuts. An abrasion happens when the skin is scraped across a rough surface, such as falling and scraping your knee. A laceration is when there is a deep cut or tearing of the skin. Lacerations are different from abrasions, which remove skin. Lacerations separate skin and may need more intervention for better healing. Superficial lacerations can be managed at home, but deeper lacerations sometimes need to be closed with dermabond or medical glue, staples, or stitches. How do you know if a laceration needs closure? If the cut is gaping, meaning the skin edges are far apart, we would need something to bring those wound edges together for better healing. If you did nothing for this kind of laceration, it will likely heal, but wound closure helps prevent infection, aids in healing, and reduces scarring, so it is recommended for gaping wounds. Tip: if you have to use your finger to push the wound edges together, it likely needs intervention. What are common wound closure techniques? In pediatrics, common things to close gaping lacerations are dermabond, stitches, and staples. Dermabond is typically a good option for clean wounds that are less than 5 millimeters deep, involving the face, extremities, or torso. Dermabond glue dries within a few minutes. It's pain-free to apply and is typically a less intimidating method of closure for children. It can sometimes be applied in a pediatrician's office, but it's best to call ahead to make sure they can provide this service. If not, urgent care should be able to assist you. ERs can do them as well, but from a financial perspective, a doctor's office or urgent care is more affordable and can get the job done with dermabond. Dermabond cannot be used on joints, hands and feet, the scalp, mucosal surfaces like your mouth, high moisture areas like the underarms, or close to the eye, as it can get into the eye and cause the eye to glue shut. We do not want that. This is my son's laceration after he fell at the playground. You can see the gaping borders that needed closure. He ended up getting dermabond to close this wound. Stitches are needed for larger, deeper, or jagged wounds, wounds over joints, or areas with high moisture, armpits, groin, or lips. This is because dermabond is not strong enough to hold the wound edges together, and sutures or stitches are needed. Depending on the location of the wound, a pediatrician or ER physician can close, but sometimes a plastic surgeon may be necessary. If stitches are needed, the area is numbed and the clinician will suture the wound closed. Depending on the wound location and type, they may do dissolvable stitches or ones that need removal. Staples are generally used in more high-tension areas like joints or areas with thicker skin like the scalp because they have a stronger hold, but your healthcare provider will determine what is needed. Staples also need to be removed just like stitches anywhere from 7 to 10 days after application. Here are some reasons you will need to take your child in for an abrasion or laceration. Dermabond is most preferred for wounds on the face and not near the eyes or mucous membranes. Think areas that can't be flexed or moved too much or are excessively sweaty. You can go to your doctor's office or urgent care, and if they're not available for this, an ER is your best bet. Any significant wound injury or laceration to the lip should be seen in the ER for optimal closure with stitches by a trained clinician and, like I mentioned, maybe even a plastic surgeon. If your child has a gaping wound on the back of their head, that will likely need staples, and you can go to your doctor's office if they have those resources or in urgent care. Make sure to watch my video on head injuries for more guidance. Your clinician will assess the wound for whether it needs closure and discuss options with you. Depending on the wound and if it was dirty or not, your clinician may ask you for your tetanus status. Clostridium tetani, or the bacteria that causes tetanus, can enter the skin through a wound or break in the skin and can spread throughout the bloodstream. Because of this, it's often recommended that your child receive a tetanus shot if they haven't had one within the last 5 years and the wound is deep or dirty, or if the wound is clean, but the child has not yet received 3 doses of the tetanus vaccine. As you can see in this chart, a tetanus immune globulin is also recommended if someone has not received 3 doses of tetanus and has a dirty wound. This immune globulin provides temporary immunity against tetanus by directly providing antitoxin. It's best to talk to your clinician about your child's immunization status to determine if another dose or intervention is necessary after an injury. Depending on the nature of the wound, they may recommend an oral antibiotic or topical prescription antibiotic like mupirocin to prevent infection for wounds. These are often prescribed for bites that break the skin on the hands, face, or genitals, puncture wounds like from a cat, bites near a bone or joint, or those that appear particularly deep or dirty. And of course, if the laceration needs closure, they will close it whether it's dermabond, stitches, or staples. Before we talk about proper wound care, let's talk about how incredible the body is when it comes to wound healing. Often in the first few days after an injury, the area can be sore and appear red. This happens because the blood vessels around the site expand to allow white blood cells to access the area to repair damaged cells and kill any bacteria at the site. During this phase, in the first few days after the injury, a scab will form over the site. Don't pick the scab because it's part of the healing process. After the scab forms, the body works underneath to repair the damaged tissue and to create new, healthy skin cells. As the healthy cells develop underneath the scab will loosen and eventually fall off, often leaving a scar in its place. It's magic. So if our body is amazing and does all that, why do we need to do any additional wound care? Well, often wounds are dirty, meaning there's dirt, debris, and bacteria are introduced to the tissue underneath, putting our body at risk for infection. Our body does its best to fight infection and repair the skin damage, but by cleaning the wound and caring for it appropriately, we can help prevent infection, promote healing, and minimize scarring. The latter being huge for cosmetic reasons. Let's get to some wound care tips and some common mistakes to avoid. Step 1. If there's bleeding, stop the bleeding by applying pressure with a clean paper towel or gauze. If it continues or the wound edges are gaping open, seek medical attention. Step 2. Ditch the hydrogen peroxide and use soap and water. That's right, no more sting of hydrogen peroxide being squirted on wounds. Your kid is going to thank you. This can actually remove the healthy cells needed for wound healing even in those early stages. Simply use soap and water when cleaning any wound with a clean paper towel or towel. Step 3. If your child needs stitches, dermabond, or staples, follow directions for care and follow-up. If your child does ultimately require staples or stitches, you should keep the area clean and dry for at least 24 hours. Keep the wound covered to prevent any dirt or bacteria from entering, and when finally able to clean it, use mild soap and water and then pat the area dry with a clean towel. If your child requires dermabond, keep the area clean and dry for 24 hours and allow the dermabond to naturally fall off on its own. Don't put any ointments on top of the dermabond. With staples, stitches, and dermabond, you should avoid submerging the wound in water, like in a bath or pool, until removal or when allowed by your clinician, as this can increase risk of infection. Step 4. For healing wounds, keep it lubricated. For clean wounds where debris was removed, use Vaseline or Aquaphor healing ointment, which is the optimal choice for skin barrier repair. In the past, it was thought best to dry out wounds by exposing them to air, but evidence actually shows that keeping wounds moist with petroleum jelly helps the skin repair faster and reduces risk of scarring. Just make sure not to put too much, a very moderate amount can go on. Step 5. Ditch the triple antibiotic. Antibiotic ointment is helpful to apply if the wound was dirty, and you can reapply with bandage changes daily until the wound is healed. But ask your clinician if petroleum jelly is enough or antibiotic ointment is needed. For most wounds that were cleaned, petroleum jelly is enough. If using antibiotic ointment, remember that over-the-counter Neosporin and triple antibiotic ointments are not recommended as they contain neomycin. And neomycin can commonly cause a contact allergic reaction when it comes in contact with the skin and can irritate the skin further, making it inflamed, painful, or itchy. And this happened to me. I never had an issue with triple antibiotic, and I used it after a minor dermatological procedure, and bam! I got a local allergic reaction which impacted wound healing. It burned so bad. You can almost tell from these pictures. Don't make the mistake I did. If antibiotic ointments are needed, bacitracin is an alternative that is less likely to react with the skin. And if an antibiotic ointment is really needed, a clinician may prescribe you one like mupirocin. Step 6, bandage it up, but don't put them too tight. Fun bandages for kids help, or even just gauze with medical tape. Sometimes adhesives can irritate sensitive skin, so gauze can be a great choice. Limit putting the bandage too tight as we need circulation for healing. Step 7, monitor for signs of infection. This is so key, especially for our kiddos who are busy bees and are not always leaving bandages on or washing their hands. If you see any of these, see a clinician. A common concern amongst parents is how to prevent a scar from forming or persisting. Scar tissue can be darker or lighter than the surrounding skin and is often thicker and less elastic, making it stand out. No matter what the injury, whenever there is a break in the skin, there is a risk for scarring. This is important for me too because I had a big gash when I was a kid on my forehead, and now my son has one too. Wound healing and reducing scar formation can have a cosmetic impact, so here are my most important tips. Keep the wound moist during the healing process. As discussed, remember a moderate level of petroleum jelly. Cover the wound to encourage not picking the scab. Use positive reinforcement, explaining importance, and fun bandages can help. Stay away from topical mederma as this can actually burn or sting and have a similar contact reaction to triple antibiotics. Once stitches are removed or dermabond is gone and wound is healed, my go-to is ScarAway. This is an amazing silicone sheet that works wonders for reducing scars and scar formation. These sheets work by keeping the scar moist, which helps to soften and flatten the scar, which ultimately allows it to fade over time. I use Freedom Mom silicone sheets for my C-section scar and use ScarAway for my son as well, and look at these results. This is day 1 of starting to use the sheets. You can see he has a bit of a keloid. The sheets are recommended to be used for 60 to 90 days, and this is when we stopped about 75 days later. Incredible. We kept it on day and night and put a new one on when it fell off or it had been 10 days, whichever came first. When considering silicone sheets, keep your child's personality in mind and read the packaging instructions because your child will need to keep the sheet on and not play with it, which can be hard for most kids under 3. And most importantly, for reducing scar formation, be sure to keep the wound protected from the sun. Ideally, keep it covered from the sun with a bandage, but when that's not an option, be sure to use plenty of sunscreen. The UV rays of the sun impacts the healing process of wounds and can lead to hyperpigmentation, so sun protection is key. I hope you appreciated these practical tips to get the most optimal care and results after a wound for your child or maybe even yourself. Want more information on this topic or have any questions? Comment below with any questions or future content suggestions. And if you found this information helpful, please like and share this video and make sure to subscribe to be the first to know about new videos published. I'll see you all next time for another video here on Peds Doc Talk TV. Stay well.